Hi, this is Dr. Puja Suri. I'm a homeopathic physician. I've been practicing homeopathy since 13 years. This time I'm going to make it a short and helpful video for all. Today's topic is obesity, a complex disease. What is obesity? Obesity is abnormal or excessive accumulation of fat in the body. Obesity being a medical problem that increases the risk of other diseases is much of a cosmetic concern these days. There are various causes of obesity that we will discuss. Obesity develops over time when you consume more calories than is used by the body. This is also termed as energy imbalance, when the energy in does not equal your energy out. Food that you eat is turned into energy for immediate use for daily body functions and physical activities, and some energy is stored for future use by your body. Here, sugars are stored as glycogen in the liver and muscles, whereas fats are stored mainly as triglycerides in fatty tissue. Energy imbalance causes your body to store more fat than needed. But the risk of obesity is determined by many other factors too. Number 1. Lack of physical activity. If we talk about physical activity, it has declined to too much extent these days due to sedentary living. As screen time is increased, physical workout has been vigorously reduced, which in turn causes weight gain or obesity. Next is unhealthy eating behaviors. Eating more calories than needed can lead to obesity. The number of calories you need varies on age, sex, and physical activity level. Eating too much saturated fat can also be the cause of obesity. Saturated fat in your diet should be no more than 10% of your total calories. Sugars in your diet also play a major role, so you must check on the sugars consumed. The next cause can be lack of good quality sleep. Research has shown a link between poor sleep and increased BMI, that is basal metabolic rate. If regularly you are not getting a good quality 7 hours of sleep per night, it can affect your hormones that control hunger urges. So, in case of sleep deprivation or deficiency, we tend to eat more. Now the next is health conditions. Some metabolic conditions and polycystic ovarian disease can also cause obesity, which can further lead to complications. Then is stress. The most common ailment can be seen in the sedentary lifestyle. Stress can affect the brain and trigger the body to release hormones such as cortisol that control hunger urges. This hormone change can make you eat more and store more fat. And next cause is genetics. Genetics do play some role, as some people are predisposed to being heavier. People with a genetic high risk of obesity can make their lifestyle healthier to avoid weight gain. The next cause is medicines. Some medicines cause weight gain, such as antipsychotics, antidepressants, birth control pills, glucocorticoids, beta blockers, etc. They may disrupt the signals to the brain that tell you that you are hungry. So these were the causes for weight gain or obesity. As we have many things and many solutions that are available on the internet these days, but it is always recommended that one should never follow any treatment blindly without consulting a well-qualified physician. Now let's talk about the homeopathic approach towards obesity. there are medicines according to the disease that has led to weight gain. We can treat a person as a whole, not only focusing on the patient's weight. The overall health of the patient is monitored and taken into consideration. After taking history, the most symptom similarity based medicine is selected and prescribed. Now I will represent a case in which a female suffering from hypothyroidism lost 7 kgs of weight in 22 days with homeopathic medicine and a customized diet plan. A female 39 years visited the clinic for obesity and her present weight was 89 kgs. She was little shy in having the conversation. She was a patient with hypothyroidism where TSH was 26 and wanted to lose weight. She had been taking Eltroxin 50 mg for 7 years. On proceeding with her case, she told about her relationship with her husband in which she was not very happy and she had a feeling that she was left by her husband as her husband was involved in some other relationship. After every complaint, the patient was saying the same words, "Will these medicines help me or will I stay like this forever?" She was very much doubtful, but still she wanted the treatment. She was very sad and that was reflected well in her case. Now I will show you the repertorial sheet, and the rubrics that I took were: number 1, despair, recovery of; second was abundant, forsaken feelings; third was timid; fourth was anguish; and fifth was hypothyroidism. Medicine according to selected rubrics was calcarea carb. With calcarea carb, fucus vesiculosus mother tincture tablets were prescribed to the patient. She was also provided with a customized diet plan and the result was amazing. She was not only reducing weight, but her TSH value has also dropped to normal. In the follow-up, after 22 days, she reduced 7 kgs of weight and was in a calm state of mind with no worries and anxiety about the disease. So this was the beauty of homeopathy with well-selected remedies and minimal dosage. Many such homeopathic medicines are used for obesity, and if obesity is accompanied by any other disease or is the cause of any other disease, then individualization is to be done and the most selective symptom-based remedy is to be prescribed. This was all about obesity and homeopathic treatment for obesity. Discover the new you with an exclusive medically monitored weight management program with the best results. Thank you for watching this video. Stay healthy, stay connected.